Hey, in this video, I'm going to give you my honest physical therapist review of Penetrex Joint and Muscle Cream. Now, this product's main ingredient is Arnica, and it's marketed for use on muscle and joint aches. Now, I'm not paid by Penetrex or any other companies to do this. This is my full, honest review of this product. My name is Dr. David Minoff, and I'm a specialist physical therapist at Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgeries, injections, and pain medications. We make videos with helpful advice and tips, exercises, and stretches for a variety of problems, including back issues, hip, knee, shoulder problems, and much more. You can check out all our playlists of videos over in the playlist tab. You can find it here on YouTube. I've also put a link to it in the description. If you just hit see more, there's a link for our playlist tabs down there, and you can find a specific condition you're dealing with to look to see how to get long-term relief from it. Now, please consider subscribing to our channel so that you don't miss out on any of the helpful videos we post every single week. So let's get into Penetrex next. Now, this ingredient, Arnica, I need to talk to you about Arnica just a bit before I take this out and put some on so you can understand how this works and see the product itself. Arnica comes from an Arnica plant. It's a mountain Arnica plant. That's what it's called. I think the scientific name is Montana Arnica. And it looks like a flower, a yellow flower plant. And when this plant is broken down, you can get the compound Arnica out of it. And that's what's used as a main ingredient in Penetrex. Now, there's some other active ingredients in here. And it says here on the front, vitamin B6 as well as MSM, which stands for methyl sulfonylmethane. I might have butchered that. I'm not a pharmacist. I'm not with the 15-syllable words. I can't quite keep up. But I'll tell you about them. I know about them. Vitamin B6 is known as a mood enhancer. It's used for a variety of other things. Something else that's notable is going to be rheumatoid arthritis, relief from rheumatoid arthritis, inflammation. So that's, I assume, one of the reasons why they put vitamin B6 in here. And then MSM, the methyl sulfonylmethane, is known to have an anti-inflammatory effect on things like tendinitis, bursitis, and arthritis. So that's why they've mixed that into this product here. Now, this is a cream, so it's a water-based cream rather than a salve or a balm, which is an oil-based product. So this does not leave any residue on your skin. It's absorbed by your skin, and so there's low risk of you staining your clothes or just feeling slippery. Now, the odor is a lot less than some of the other things out there. This doesn't have menthol or mint stuff in it. A lot of it anyway has a little bit, but not enough to make it very powerful to where everyone knows that you put something on. This kind of diminishes real quick, and it doesn't really carry an odor with you. Now, some side effects for this. The only side effect they list on here is skin irritation. And so my assumption is if you've got an allergy to one of the products in here, one of the components of this, then your skin might get red, you might get irritated, you may get bumps or like a rash looking skin, or you could also get itchy. If you get any of those symptoms, then you should not continue using Penetrex. You should avoid it. But it's rare to get that, and for most people, I see clients that have told me about this and their success with using it, it really doesn't cause any sort of side effects. So they got to put that on there for the less than 1% of people that get those effects. They don't have any other side effects to it. This is a natural product. I would classify this as a natural product. So it's tolerated by the body pretty well. So let's open it up and show you how to use this, see what it looks like. I've already opened this. I've messed with this before, but I just wanted to see if it had changed at all. It's the same old Penetrex. Just to show you what it looks like a cream. This little container looks like a little cream container, lotion container. And there it is right there. It's white. It's got a very subtle smell to it. If I'm this far away from it, I can't really smell it. I have to put my nose pretty much on it in order to smell it, and that's how weak it is in odor. And then when you get some, if you're going to put this on for the first time, let me use my other hand. You just get a little bit like that and rub it on an area and rub it in. You have to rub it in so that it is absorbed by your skin. Put the remaining back here. And you would do this just to test your skin on it to make sure you're not going to get any sort of irritation. So rub that in. Once all the white goes away, you don't have any clumps of the Penetrex on you, then set a 10-minute timer. If you're concerned, then go for a full hour and see if you get any redness, irritation, or bother. You're probably going to clear out just fine and not have any issues with it. If you do, of course, take this back, return it, or avoid using it, gift it to somebody else who might not have any reactions to it, because they might benefit from it. But if you're good to go, you don't have any reactions, then you got to get a little bit more. Maybe like that. I'm just going to use my wrist. So if I was putting it like on my back, I put a lot, or on a leg muscle or my upper arm muscles, the bigger part of your body. But now down in a wrist or a hand, you just need a little more than a dollop. And you got to rub this in. Let me put this down. You got to rub this in effectively. I would massage a bit and just get it in there and keep rubbing. It won't take you more than a minute, but rub until it dissolves all the way. You don't have any more clumps. And you'll see after about 30 seconds, maybe even a little bit less, your skin starts to absorb this. You won't have a film on your skin of like an oil or like a salve, a balm that leaves an oil, which some people like. If you're concerned about staining your clothes or just feeling slippery or having a heavy odor, this does not stain your clothes or feel slippery. Like right now, it feels like my skin's just moisturized now, not necessarily like I have oil in it or anything like that. And what the instructions say is to rub this in 3 to 4 times a day. So if that was the first time I'm doing it today, I'd be looking at doing this a few more times. And then to continue that process, keep putting it in 3 to 4 times a day on your painful body area for 7 to 10 days. So it seems like this needs to build up onto your skin in order for it to penetrate enough to get the effect that you're looking for of the pain relief. So it's not enough to just put this on for 1 day or 2 days. You have to commit to putting it on for 7 to 10 days. So depending on the size of body area that you're dealing with, you might consider getting a bigger container. This is 2 ounces right here. They do sell it. I saw an 8 ounces a container at the store. I haven't seen anything bigger than that, but maybe it's available out there. But if you're going to be putting it on big leg muscles, hip muscles, your back, of course, you want to probably get a bit more so that you can endure the 7 days and truly put it to the test. Now, relative to pain medications, this is a little less expensive than if you were to get a supply of over-the-counter pain medications. And obviously it's natural, so there's less risk for injuring your organs with this. Now, let me give you my honest opinion about this. I love the natural side of this. I'm all for trying out as many natural products as you can, pain relieving products, so that you can reduce your dependency on over-the-counter pain medications as well as prescription strength pain medications. Or if you're somebody that goes to the doctor for injections or you're considering having a surgery, then you really need to put this to the test, exhaust your options like this, your pain creams that might be of benefit to you. But you just have to realize that this is not going to give you a long-term relief. If you got like arthritis, for instance, and you're in somewhere in your body, in your hip joints, shoulder joints, or your spine, your neck, somewhere like that, or even down in your knees or ankles or feet or hands, this might be something to take the edge off so that you can get through the day and not get so flared up and tolerate life a bit more and maybe sleep a bit better at night. And it's not going to damage your internal organs as much. But you need to still pay attention to fixing the long-term problem, which usually requires you looking at the muscle imbalances in the area, which we talk at length about on this channel. So if you want to learn more about fixing the long-term problem, then make sure you go to our playlist tab or go down into the description below here and find the playlist tab link and then find your body part. Another option you can do is go up to the search bar in YouTube and type in El Paso manual physical therapy, and then the body part like hip pain or knee pain or hip arthritis or back problems or degenerative disc disease. We've made videos on tons of things, and chances are we can help you out if you just search for our videos. So I hope this video was helpful for you, learning about Penetrex, seeing how it works, and learning about the active ingredients and side effects. If you thought it was helpful, please give us a thumbs up. Please share this with somebody that you think needs to learn about this. This isn't the most mainstream pain cream out there, and it might be right for you. You might just have to dig and find and see what works for you. So please share this with somebody that you think would benefit, and I hope to see you in the next video. We'll talk soon, friends. Bye-bye.